Happy day to all. This is Dr. Nivedita, co-founder and chief physiotherapist of Sri Ahana Physiotherapy Clinic and Academy. This video is on scapular dyskinesia. Scapular dyskinesia is nothing but the abnormal position or movement of the scapula, and the clinical presentation includes reduced upward rotation, increased downward rotation, anterior tilt or elevation, and internal rotation. Optimal position of scapula during elevation includes external rotation, upward rotation, and posterior tilt. But whatever is going to come under the classification of scapular dyskinesis will not have all these optimal position of the scapula. So the classification of the scapular dyskinesis is into four categories. We have type 1 where the inferior angle is prominent, in type 2 medial border is prominent, and in type 3 superior border is prominent, and in type 4 there is symmetrical scapulohumeral appearance. Type 1 where the inferior border being prominent. At rest, the inferior medial border of the scapula is prominent. During arm movement, the inferior angle tilts dorsally as seen in the demonstration, and the acromion tilts anteriorly or ventrally. Type 2 is of the appearance of medial border. At rest, the entire medial border is prominent dorsally and the axis of rotation is vertical in the frontal plane. Next we have type 3 superior border. At rest, this superior border of scapula is elevated and the scapula is anteriorly displaced. During arm movement, shoulder shrug initiates movement without scapula winging, and the axis of rotation seems to lie in the sagittal plane. Next we have type 4 where the symmetric scapulohumeral appearance can be seen. At rest, both the scapulae appear to be symmetrical, but the dominant hand may be little lower than the affected one. During arm movement, scapula rotates symmetrically upward such that the medial border remains to stay by the thorax and the inferior angle moves away from the midline. The reverse occurs when the arm is lowered. I hope with this video, scapular dyskinesia would have been clear. Thank you.